Scars are the result of the body's emergency repair system, generally caused when that same repair system creates too much collagen or fails to shut down. I spoke with Dr. Anil Punjabi of Redlands Community Hospital in Redlands about recent advances in scar treatments.
A scar is the attempt by the body to heal a break in the skin. And that break in the skin can happen with trauma, can happen with surgery, can happen with a birth defect. What the body tries to do when there is a cut, it tries to mend that wound by laying down collagen. Initially, that collagen that the body produces is excessive because at that point the body wants to produce as much of this protein to close that wound, to seal the wound, to protect the body. It is a response of protection. Then the body begins to do the remodeling phase. In this phase, they actually take away some of that excess collagen. It actually produces proteins to smoothen it out. It actually takes away some of the redness which is there because of the excessive production of blood vessels. Once that happens, the wound begins to soften. It begins to flatten, the scar begins to get lighter and become less noticeable. There are some patients who are predisposed to forming thick scars which are known as hypertrophic scars. Hypertrophic scars are different from keloids. Keloids are scars which have basically run amok. Remember when I was saying that the body has mechanisms to produce the excess collagen and then to turn it off? In patients who produce keloid, that turn-off mechanism is missing, and the body keeps continuing to produce the collagen to the point that it forms a tumor where the initial injury was. So when a person has even a small little trauma like having the earlobe pierced, they can form a scar which is about 3 times the size of the earlobe.
We asked Dr. Punjabi what can be done to treat scars.
There are many ways to approach that. If the scar is not hypertrophic or keloid, then one can re-excise the scar and approximate it so that it will heal without any asymmetry and redness. Sometimes you have to use lasers in order to bring the redness in the scar down to an acceptable level. And of course, when patients do have keloids or hypertrophic scarring, they may also need injections with steroids to control the inflammation and to control that excessive production of collagen and fibroblasts, which are again the binding protein that the body produces to close that wound.
How successful are these new treatments, and how do they eliminate scars?
The main advances that have happened in scar reduction have been the understanding of the biology, and we have understood that it is best to treat scars not in the active changing phase in the first 6 to 9 months of the year of the initial trauma, but actually wait for at least a year before we actually start changing that. So that understanding of the biology, you actually then harness the changes that the biology is going to produce to actually get a better scar. Till this day, unfortunately, we don't have a magic wand that we will be able to use to completely obliterate or make a scar go away. We can always make it better, we can make it less noticeable, but we can't make it completely go away.